Sit back and imagine yourself completely unconscious. Meanwhile, your upper jaw is being rigorously sawed into thirds. Nerves inside your mouth are snipped like hair at a barbershop, and you have lost about 1.5 pints of blood from your facial region. 9 hours later, you awake in the intensive care unit. You struggle to come to your senses, only to find that your arm is hooked to a morphine drip. Realize that there are multiple tubes running inside your nasal cavity, and both your upper and your lower jaw were shifted into different places than before you were awake. Believe it or not, that particular day was one that I looked forward to for several years. And the surgery was one of the most joyful and bittersweet experiences of my life. Oral and maxillofacial surgery, although it carries a risk of serious medical and post-operative side effects, can be highly beneficial to the individuals pursuing this medical procedure. My name is Angel Shabani, and today I will define oral maxillofacial surgery, the complications of surgery, and share my own personal experience with the surgery. By the end of this speech, I want you guys to have a stronger comprehension and an improved understanding of oral and maxillofacial surgery. So what is oral maxillofacial surgery? It is defined as a field of dentistry which includes the identification, surgical, and connective treatment of disease, injuries, and deficiencies concerning both the practical and visual characteristics of the hard and the soft tissues of the oral maxillofacial region. It is also one of the 9 dental subjects acknowledged by the American Dental Association, Royal College of Dentists of Canada, the Royal Australian College of Dental Surgeons, and College of Physicians and Surgeons, Pakistan. Doctors are highly qualified, and a continued education is important for them keeping up to date with the latest and greatest and fast changing technical advances procedures in this field. That sounds great, but what are the complications? There are complications such as bleeding, swelling, infection, nausea, and vomiting. There could also be numbness in the face due to nerve damage. The numbness may either be short-term or, more infrequently, everlasting. So generally speaking, complications may occur, but not often. And in my own personal experience, I possessed a class 3 underbite where my lower jaw protruded further than my upper jaw. And I would say that I had the Jay Leno effect going on. And it progressively worsened throughout my adulthood and bothered me because I believed it to be an instinctual distraction upon meeting people. So I decided to pursue the surgery in October 2004, and it was complete on April 6, 2011. One advantage of having surgery is that my appearance looks much better. For example, I believe that my face looks thinner and more aesthetic. Second, my confidence has improved and I feel less anxious about meeting people. So in my opinion, the benefits of oral maxillofacial surgery outweigh the associated risks and potential complications. In conclusion, we discussed the meaning of oral maxillofacial surgery, the complications of surgery, and my personal experience with the surgery. Although it's been 10 weeks after surgery, I have no regrets. I hope that you have enjoyed learning more about this particular surgery, and you can follow me on YouTube under The Shabanimal. It's been a pleasure. Thank you guys. Have a good day.